Hello, this is Elena Coucher. I will be presenting to you Chapter 32, The Toddler and the Family, probably the most fun developmental stage of all. I mean that with the most sarcasm that I can, and it's the one that is very challenging for parents. So we're promoting optimal growth and development still. This is the time of the terrible twos. Toddlerhood is very challenging. It starts at about the age of 12 to 36 months. It's a very intense time of exploration. They are attempting to control their environment and people with negativism and tantrums. It's also a very important time for intellectual and developmental growth toward autonomy. And again, it's very challenging for the parents to and caregivers to deal with the children during this time. Um, they are just in the process of finding out who their little selves are, and in that process, the temper tantrums, the word no becomes very popular. Screaming and crying over very little things. So proportional changes, the weight gain slows to 4 to 6 pounds a year. Their height increases about 3 inches a year. Their birth weight should be quadrupled by about the age of 2.5 years. They get elongation of the legs rather than the trunk, and their growth is step-like rather than linear. The anterior fontanelle closes by 12 to 18 months. The head and chest usually become equal in size by 1 to 2 years of age. The chest increases in size and surpasses the head during the toddler years. After age 2, the chest circumference exceeds the abdomen, giving the toddler a taller, leaner look. However, they still look a little pot-bellied due to weak abdominal muscles. Their legs may be slightly bowed, related to the heavy trunk and abdomen, and the adult height is about twice that of a 2-year-old. Look, I mean, here's an idea. Look in your baby book if you know where those are. Now, I kept baby books on my children, and my children don't keep baby books. Their baby book is on Instagram and Facebook. Look in some of your baby books and see how tall you were at 2 and see if you're twice that height now. So sensory changes, visual acuity of 20/40 is acceptable at this age. Hearing, smell, taste, and touch continue to develop. Depth perception is better, but still a lot of falls related to less motor coordination. They're less likely to try new foods because not just related to the taste, but appearance or smell preferences. All senses are used to explore their environment. They will touch it, taste it, shake it, throw it, and put everything in their mouth. It makes aspiration and poisoning an increased risk. Maturation of the systems. Most physiologic systems are relatively mature by the end of toddlerhood. The respiratory and heart rate slows, blood pressure increases, body temp is maintained. The respiratory tract, they are at risk for upper respiratory infections, otitis media, tonsillitis. Those are very common. And that's because the throat and ear structures are still short and straight, and the lymphoid tissue of the tonsils and adenoids are enlarged. The volume of respiratory tract illnesses increases. Respirations remain abdominal for these babies. The renal system, it's maturing. It's able to conserve fluids in time of stress, decreases risk of dehydration. The bladder capacity increases so they can retain their urine longer. The GI system, they have increased acidity of gastric juices. It's protective. It destroys bacteria. They have increased stomach capacity, allows for 3 meals a day. They still need snacks, though. Prominent changes in the GI system. So physiologically able to control elimination related to the myelination of the spinal cord being complete at that point. They're able to control their sphincter between 18 to 24 months, but may not be cognitively ready. Defense mechanisms of the skin are intact, related to phagocytosis and being more efficient, and production of antibodies are well established. However, we see an increase in illnesses when they enter preschool or daycare because they're exposed to pathogens and poor hand hygiene. And now that's not with all places. A lot of daycares or Mother's Day Out programs have instituted hand washing. I know when I take my 3-year-old grandson to Mother's Day Out for his mom, the first thing that they do is take their jackets off and go to the sink and wash their hands. And they have a regular routine of washing their hands, which I was really happy to see. You probably should look at table 32.1 on 929-930. There could be some important information on there for you to know about for testing purposes. Gross and fine motor development, locomotion, refinement of coordination, and equilibrium. They may walk alone by 12 to 13 months with a wide gait for balance. At 18 months, they're going to try running, but they'll fall easily, so think safety. At 2 years, they're going to go up and down stairs with both feet on one step, kick a ball without falling. At 2.5 years, they're going to jump on both feet and stand on one foot for a couple of seconds, take a few steps on their tiptoes. At 3 years, they're going to stand on one foot, walk on their tiptoes, climb stairs with alternating feet. With fine motor development, they're going to have improved manual dexterity. At 12 months, you are going to expect them to grasp very small objects, but unable to release them at will. 15 months, they're going to throw objects to the floor. They can hold a spoon, but rotate before it gets to the mouth. They'll build towers of 2 blocks. At 18 months, they'll throw a ball overhanded without falling, and they manage their spoon a lot better. At 24 months, turn pages of the book one at a time. They turn doorknobs, so we have to think in terms of safety for this as well. 36 months, they'll build tower of more blocks, up to 8. They'll have good hand-finger coordination. It improves in all areas: play, dressing, language, comprehension, response to discipline, social interaction. Propensity for injury increases, so we do have to think about the safety. This is our motor skill development table. It just kind of breaks it down for you. A little easy to study on that one. So in psychosocial development, tasks and goals to achieve, there's specific tasks and goals that toddlers must deal with. Differentiation of self from others, particularly the mother, toleration of separation from the parent, ability to delay gratification, control over bodily functions, acquisition of socially acceptable behavior, verbal means of communication, ability to interact with others in a less egocentric manner. Parents have to be consistent and reliable to help gain trust in that first year to help the toddler move on to autonomy. It is an important developmental task for basic trust to move on. They have to learn to give up dependence for independence. And, we talk about Erikson quite a bit. His stages of development. They must develop a sense of autonomy while overcoming a sense of shame and doubt. Negativism, attempting to express their will and control others. And they might go from temper tantrums to wanting to be cuddled, so they'll have mood swings. They can be very challenging for a parent or caregiver. They're going to have to learn to deal with it and not always give in to the toddler. Because it doesn't teach the toddler how to respond well to others. Ritualization provides a sense of comfort with sameness and reliability. That's the reason why hospitalization can cause such distress for toddlers. As the toddlers develop, they deal with the id, the ego, and the superego. The id is the control of impulses, so they have to learn socially acceptable behavior. The ego, reason or common sense, so they have to learn to tolerate delayed gratification. The superego is the conscience. Morals, they learn to trust and differentiate themselves from others. They're aware of ability to achieve and to fail. And that develops during the preschool years, and not during the toddler years. Just kind of giving you some of the stages of development for Erikson's. Piaget's cognitive development. Cognitive processes develop rapidly between 12 and 24 months. There's sensory motor phase. There's tertiary circular reactions. Those are developed around 13 to 18 months. And it's a further differentiation of oneself from objects. Their ability then to venture away from the parent and tolerate longer periods of separation. The awareness of casual relationship between two events. So when I flip a light switch off and on for long periods of time, and be excited each time the light goes off or on, it will not transfer that knowledge to the next light switch will do the same. So they will have to investigate each time. That light switch did that, or that little button over there did that. Does the next one do that? It will also do an unsafe activity over and over, not realizing it will hurt them each time. Begin to categorize data into distinct classes and subclasses. Sees a basket as a basket, does not see a toy basket different from a trash basket. So they may put their toys in the trash or dig in the trash basket. They're unable to judge what is appropriate and inappropriate where that's concerned. Object permanence is something important for you to know. Object is still there even though it cannot be seen. They see a parent put an item in a cabinet and will try to look for it. So you have to think about safety, and you want to put things up high. You want to lock cabinets. You are the only safe way to have that. Let's just face it, you can't keep them out of the cabinets, and having a safety feature on there so that they can't go and open the cabinets up protects them. They have active experimentation used to achieve previously unachievable tasks. Experiment with hitting different items with a toy to get different responses, like a drum, boom, boom. The table will go bang, bang, and the brother will say, ouch. Applying knowledge to new situations, it goes along with experimentation. Learn where things fit in their world. They can put a small ball in their mouth, but not a beach ball. Learning spatial relationships, recognize different shapes in their relationships, and place a round object into a round hole. And this is just kind of an example, a visual of the tertiary circular reactions. The child does something like squeezes the rubber duck. That causes a reaction. The duck squeaks. So the child squeezes it over and over, get the same reaction each time. Cognitive development, invention of new means through mental combinations. Final sensory motor stage is 19 to 24 months. Again, object permanence, something that I mentioned before, mentioning it again, is one of the most dramatic achievements. They will actively search for a hidden object in several possible hiding places. Infer cause when only experiencing effect. Conclude that the object could be hidden in any of the places they look, even if they only saw it hidden in the initial hiding place. Domestic mimicry, imitation of behaviors. They'll identify with the same-sex parent. Little girls will identify with mother and want to cook. Little boys will identify with daddy and want to mow the yard. Toys help that and pretend. Concept of time is evolving, but still is very early. Sense of time in terms of anticipation, memory, and limited ability to wait. Limited attention span. Mom will return after your nap. Daddy will come home after Sesame Street goes off. They're not able to take turns until about the age of 3. And the concept of time, I'll give you another little example on that. When I'm leaving my grandson's house, he's 3 years old, and he will say, Mimi, you be right back. And I'll say, I used to say, well, I'll come back tomorrow. Well, that to him, he's not catching what that is. For him, I have to give some definitives. After you go to bed tonight and you wake up in the morning, Mimi will be back. So, I have to kind of break them down and explain it just a little bit differently for him to understand. And this is just examples of domestic mimicry. The pre-operational phase is 2 years to 7 years. That's the span of it. The preconceptional phase is a subdivision, so it's aged to 2 to 4 years. Pre-operational thought implies children cannot think in terms of operations. So ability to manipulate objects in relation to one another in a logical manner is what that is implying. It's a transition between self-satisfying behavior and socialized relationships. Problem solving is based on what they see and hear and not what they remember. As language skills increase, they ask why and how. Two of my very favorite questions from my 3-year-old grandson: why and how. You probably need to know some of the characteristics of pre-operational thought. No example and some implications. That's in box 32.1 on page 926. Again, we're going to talk about this is that box. Egocentrism. They only see perspectives, their own perspectives. They can't see another person's perspective. They don't realize negative behavior hurts others because it doesn't hurt them. And this may be difficult for some moms to understand. My daughter is this way. She doesn't understand that he doesn't understand what he's doing. He's 3 years old. Well, it didn't bother him, so why is it bothering her? Animism gives life-like qualities to inanimate objects. The child scolds the stairs for making them fall. Irreversibility, the inability to reverse their actions. Magical, their thoughts are powerful and cause events. Inability to conserve, they can't understand mass can change size, shape, volume without changing the original mass. Same volume in a large glass looks like more than it is in a small glass. I don't want my cup. I want your cup. You have more. Transductive reasoning involves inferences from one specific to another. Global organization, reasoning that changing any part of the whole changes the entire whole. And centration focuses on one aspect rather than considering all of the possibilities. These are the developmental theories. This is just a help you study guide. Spiritual development, family and environment influence a child's perception of the world. They learn about God through words and actions of those closest to them. Spiritual routines can be comforting, like prayers before meals or bed. My son-in-law had started my 3-year-old, my grandson on when they went to bed. They used to read a story, or they still do. They read a Bible story. It's in some app that he has on his iPad, and after that, they pray for people before they go to sleep. And so this is such an impression on him that when he stays all night with me, we have to try to find something to read. I have to find something because I don't have any apps on my phone, and that's a shame. But I'll have to find something to read. We'll have to say prayers. We have to talk before he actually goes night-night. They watch everything that's being done around them. If they see mom and dad folding their hands in prayers, then they're likely to do so as well. The development of body image. They recognize their self in the mirror. They refer to body parts by name. They recognize words used to describe their appearance. And let's go back to the body parts. Parents need to use accurate names because the children need to know what they're, you don't call it, I know we call it tummy and we call it a stomach, or we call the booty a bum. And, that's not the actual name. We probably should tell them the actual parts. Child recognizes words used to describe their appearance. So you need to avoid negative labels about physical appearance, such as fat, chubby legs, skinny arms. Oh, you're such a chubby baby. The child recognizes gender differences by age 2. Toddlers protest intrusive examinations, such as examining ears, mouth, axillary tip, even if they did not do so before. It doesn't hurt, but it is intrusive of their personal space. They may protest having having parts of their body like feces flushed. They don't understand, and it bothers them. The development of gender identity. The exploration of genitalia is very common. Genital fondling can occur and can be pleasurable for a child. That's not something parents want to know about. Parental reaction will influence the toddler's attitude. The reaction should be accepting and not critical. They may have to explain this type of behavior is not done in public. Gender roles are understood by a toddler at this point. Playing house or other imaginative play. They have a sense of femaleness or maleness is formed by age 3. And attitudes about affectionate behavior is formed by watching adults. Socially developing. Major task of toddlerhood is differentiation of self from mother or significant others. Differentiation is in 2 phases. It's separation and individualization. The toddler emerges from the symbiotic fusion with the mother. That's the separation. With individualization, achievements that mark the child's expressions of personal characteristics. Due to object permanence, the toddlers realize parents still exist when they aren't there, and strangers are less of a threat. Repetition, such as when toddlers go to bed without parents and awake to find them there, reinforces the ability to separate from their parents for short periods. Rapprochement separates from parents and returns for reassurance and to make sense of experiences. A parent's inappropriate response causes insecurity and confusion. Transitional objects, favorite toy or a blanket. This provides security and decreases anxiety for a toddler when separated from the parent, under new stress, or if they're tired. Let them have their object for security. Brief separation also allows parents to rest and recharge to deal with frustrations of parenting a busy toddler. Language. The level of comprehension and ability to understand increases. Comprehension is much greater than the number of words a toddler can say. At age 1 year, a child uses one-word sentences up, down. By age 2 years, a child may use multi-word sentences like all gone, mama go bye-bye. Studies do show that TV before 12 months and for greater than 2 hours per day will cause language delay. Adult-child conversation increases the language development. Gestures such as pointing fade as language development increases. Personal and social behavior. Toddlers develop skills of independence that may result in a determined, strong-willed, volatile behaviors. Skills of independence include feeding, playing, dressing, and undressing self. Toddlers develop concern for the feelings of others. Age-appropriate discipline contributes to a healthy social and emotional development. You want to do positive reinforcement, redirection. Time out may be an appropriate punishment for a toddler at this stage. Dressing is kind of one of those things. We're going back to the spiritual and maybe the church and the role play. Mimicking whatever dad does or mom does. My 3-year-old grandson wants to wear suits to church like his daddy does. And so Mimi's gone out and she's bought him some suits and he's outgrown. And I haven't bought him any more, but he still had the suit jackets in his closet. And they were size 3T. The child's wearing a 5T now. And so he went to church one day with this 3T jacket on that was entirely too little for him. And it was just because Daddy didn't want to fight him on it. He was expressing his independence. He picked out his clothes, so Daddy let him dress in his clothes. Mama had a cow. But that's just how they are at that point. They're wanting to start picking out the things that they want to wear versus the things that you want them to wear. They might not want to take their clothes off at this time. They might want to continue to wear them. These are some of the things that moms and dads have to contend with the toddler. So let's talk about the toddler and play. Play is the work of a child. It enhances physical and psychosocial development. Interaction with others becomes very important. Parallel play, that is something they exhibit quite a bit. They play beside and not with others. Imitation, they repeat what others do or sounds they make. So one child claps their hands, the other imitates by clapping their hands. They also do tactile play, using touch to learn as they play. Sand, bubbles, clay. You're probably going to find that a 12 to 18-month-old child at this time for tactile loves to, when they get a bath, put their hands under running water. Selection of appropriate toys that foster thinking and interaction with adults, active play instead of computers or videos, and you need to think about safety and age-appropriate toys. Toilet training is probably one of the biggest things. They have to have physical readiness. They have voluntary control of sphincters that usually occurs between 18 and 24 months. The ability to stay dry for 2 hours. Decreased number of wet diapers. Waking up from a nap or nighttime sleep dry. If they have regular bowel movements, you know that there are the times that they usually have their BMs. Excuse me. Gross motor skills of sitting, walking, and squatting. These are all physical readiness for it. The fine motor skills to remove their clothing. The mental readiness recognizes the urge to defecate and urinate. Verbal and nonverbal communication to express the need to defecate or urinate. And cognitive skills to imitate appropriate behavior and follow directions. This is probably the time that I would recommend getting a treat bag to keep in a room, and if they actually go potty on the toilet, they get to reach into a treat bag, and there's something new and exciting that they pull out each and every time. The psychological readiness, they expresses willingness to please the parents. They're able to sit on the toilet for 5 to 10 minutes without fussing or getting off. They're curious about adults or other older siblings' toilet habits. They're impatient with soiled or wet diapers, and they desire to be changed immediately. And then there's parental readiness. Recognizes the child's level of readiness, the willingness to invest the time required for toilet training, and the absence of family stress or change. Probably if you're getting ready to have a new baby, or you have a new baby in the house, it's not the time to start training your 2-year-old to go to be on the potty. Bowel training may be accomplished before bladder training due to the regularity of BMs and the stronger urge. So what do we have to do? We want to teach our parents to choose easy off clothing, trainee pants and pull-ups. A potty chair so the feet can touch the floor. It gives a feeling of security and it assists with them in defecation. Or a portable seat on a regular toilet. But you need to use a stool for them. They need something to put their feet on. Parents need to stay with the child, never leave them unattended on a high toilet. Allow the child to see the toilet flushed. And practice the sessions no more than 5 to 8 minutes at a time. Use sanitary habits after each session. Wipe and wash hands. Positive reinforcement, praise, stickers, and my other daughter's house, it's nummies. Nummies is one tiny little candy bar that he's fallen in love with. Going to the bathroom with a parent or older sibling also. The daycare needs to be informed and needs to support the toilet training for consistency. In fact, consistency needs to spread across the family. If anybody else keeps the child, then the grandmother or grandfather, anybody, they need to follow the same habits. Nighttime dryness takes longer due to immature sleep cycle, and that prevents the child from awakening in time to urinate. Children who have not achieved nighttime dryness by age 6 will likely need an intervention, but definitely investigation. My grandson still gets up and comes to the bed with mom and dad. He gets all squirmy, and they know when he's all squirmy, he probably needs to go potty. So they end up waking up in the middle of the night, making him go to the bathroom and urinate. Because he's 3 years old. He still has accidents. They happen. Sibling rivalry, it's a natural jealousy and resentment of children to a new child in the family. Toddler does not resent the baby, but changes that the baby brings. There's some loss of ritualism and control. The parents now share love and attention where it may have been solely on them, and their whole routine has been disrupted. They may lose their crib, or they may lose their room. It's quite a bit for them to get accustomed to. So preparation, a good time to prepare a child for infant's arrival is when it is apparent. Uh, the toddler is aware of the pregnancy and changes are being made in anticipation for the new arrival. Be realistic about what life will be like after the infant's arrival. The baby will not be a new playmate when brought home. Talk about activities that will come with the infant: feeding, changing diapers, bathing, and dressing. Emphasize routines that will stay the same. Make time for regular story time with the older child. The dad may spend quality time while mom is occupied with the infant. So introduce the toddler to an infant if they have not been exposed to them before. You have to minimize stressors for the toddler also, such as moving the toddler to a toddler or big bed well in advance of the birth. Do not decide once baby gets there, well, we're going to put you in the big boy bed and we're going to give your bed to Sissy. Explain the pregnancy, simple pictures of the uterus and the fetus. I mean, these are interventions in your book. Feeling the baby move, I think that's something right there. And talking up the sibling. Many visitors bring gifts and show attention to the infant, but not the toddler. So parents need to be alert visitors to show that attention to the older child. They're going to act out. Stress can cause a toddler to hit the infant, pull the bottle from the mouth, insist the baby be sent back. Don't leave the toddler with the infant unattended. Toddlers may revert to regression also. It's quite interesting to see. When I talk about regression, they might start not sleeping well at night, or they want to sleep in the baby bed, or they want a bottle. I talk about my 3-year-old grandson because he's right in the middle of all of this. And when my other grandbaby was born, he was excited to have a new sister and excited to bring her home. But then when she got there, he wanted to be wrapped up in the blanket the same way that she did. He wanted to be babied the same way that she was. And he also tried to pick her up and carry her out. Temper tantrums. Oh, I think we all that have had toddlers can understand these pictures. They speak 1,000 words there. Are indication of inability to control emotions, and they're quite common. They may escalate when the child is tired, hungry, sick, or frustrated. Toddlers may assert their independence by violently objecting to discipline. They're going to lay on the floor. They're going to kick their feet. They're going to scream as loud as they possibly can. They may even hold their breath and even faint from holding their breath. And that's because the respiratory control center will take over and the child will, of course, breathe again. But, some parents may be frightened by it. They turned all red-faced. They passed out. They'll breathe. Parent education. Best approach to temper tantrums: ignore the behavior. As long as the behavior is not injurious to the toddler or anyone else. Also, offer options instead of all or none. Pick your battles. What is important and what is not. Comfort the child when they gain control, but do not give in to demands. And then you have to praise the positive behavior. Consistency in situation in response to behavior, like sameness before bedtime, brush teeth, one-story prayers, lights out, bedtime, night-night. Make sure all caregivers are on the same page. You can't play mean mommy and fun daddy because they will use it against you. Starting at 18 months, timeouts will work. After the tantrum is over, focus their attention on a favorite toy or a book. Negativism? No. that negativism is not an expression of being a stubborn or insolent child, but it is a necessary assertion of self-control. Decrease the opportunity to answer no, as in, are you ready for bed? So offer options, not many, or it will confuse. Do you want to take your medicine with juice or milk? Do you want to wear red or blue pajamas? It gives them a sense of control. They think they're making the decision. Regression. Talked a little bit about this. It's the retreat of one's present pattern of functioning to the past levels of behavior. It usually occurs with discomfort or stress, such as the new baby in the home, a hospitalization or separation as if mom is going back to work. They're going to have increased dependency, refusal to use the potty chair, temper tantrums. Maybe they're going to demand a bottle again. Loss of newly learned motor, language, social, and cognitive skills. What do parents have to do? They have to ignore the regressed activity. They have to praise existing patterns of appropriate behavior. They usually return to normal when able to cope with the stressor that set them off. Promoting optimal health during toddlerhood. Physiologic anorexia is decreased nutritional need with a decrease in appetite. It occurs in about 18 months. They become picky, fussy eaters with strong preferences, taste, texture, and appearance. It's always a fun time. This type right here ranks up there with tantrums in my book. At 12 to 18 months, the growth slows and needs like the caloric and nutrient needs decrease. Still need a balanced diet, though, with adequate protein. They need to be taken 2 to 3 meals a day with 2 healthy snacks, just smaller portion snacks, maybe stick cheese. This increased nutritional need and decreased appetite is known as physiologic anorexia. So at about 18 months, that picky, fussy eater, the strong preferences, they don't like the taste, they stick their tongue out, let it fall out of their mouth, they don't like the texture. They may not eat a food just because someone in the family won't eat it. They may eat one day and won't eat it the next. It is very frustrating for parents. They're afraid their child will starve. But offer planned nutritious snacks. The child also becomes aware of non-nutritive function of food, like pleasures, the social aspect, and the control of refusing food. The ritualism may want to wash the same dish or cup or spoon. That may be something that they like. I have an almost 2-year-old grandson that if you fix his food and you it can be chicken and mashed potatoes and baked beans, and you put it on a plate, he doesn't like it. He prefers it all in a bowl. I don't know what it is, but he likes bowls. So you just give him the bowl. They may refuse food on a different plate. They may want the same food for every meal. If it were up to him, he would eat avocado every meal. Providing a variety increases sensory stimulation needed to learn to eat different foods and different textures. Nutritional counseling. We want to prevent childhood obesity. Eating habits are formed by 2 to 3 years. Do not use food as a reward to appease. Do not force a toddler to eat or make a mealtime unpleasant. I think on that second one, I'm already breaking the rules because if he does something good and he wants a numbie, I give him a numbie. Toddlers may need to eat early than the rest of the family, but should be eating the same food as the rest of the family. Large portions overwhelm the toddler. 1 tablespoon of solid food per year of age, or 1/4 of a third of adult portion. Mastication. Chewing may not be effective, so try to avoid hot dogs, grapes, especially hot dogs and grapes, popcorn, and foods that cause choking. If your family member, if that is something that they eat and they want hot dogs, you need to advise them to cut them up in tiny, tiny little bites. Dietary guidelines in 2010 for Americans encourage a healthy diet and exercise to decrease obesity and cardiovascular risk factors. So we need a decreased daily intake of fat and sodium, increased exercise. Variety of fruits and vegetables, whole grains, low-fat or non-fat dairy products. They need iron and calcium, vitamins D and C. So what would you get these foods from? You can find those on page 935, and I would highly suggest that you look at that. Vegetarian diets increasing in popularity. Must plan well to assure adequate protein along with the other essential vitamins and minerals. Complementary and alternative medicine. Excuse me. Use of folk remedies, herbs, prayer, and massage therapy. Many megavitamins and herbs are not proven safe for children, so we have to be cognizant of that and find out the culture and the lifestyle. Sleep and activity. Total sleep decreases slightly during the second year, 11 to 12 hours a day. One nap a day is all they need. They reach adult pattern with sleeping by age 3 and 4. Sleep problems are common and come and go due to fears and awareness of separation. You need to give them the same bedtime each night. Sometimes a bedtime snack, something light. A quiet activity 1 hour before bed, such as reading, avoid stimulation. No roughhousing, action TV, computer games. Comfort objects such as the blanket, stuffed animals, or dolls. No TVs in the child's room. Set limit to the number of stories, length of time for bedtime rituals, etc. We have to be concerned about dental health. They've got all these teeth coming in. Regular dental exams by 6 months of age or 6 months of eruption of first tooth. Usually at least by 12 months. This is just a recommendation. This is from your book. My dentist recommends starting regular dental exams by the time they're age 3. Removal of plaque. Most effective brushing is done by parents, but may let toddlers start when the parents finish. So moms and dads need to do the brushing first, and then let the toddler do it. Teeth should be brushed and flossed with it after each meal. If unable to brush, have the toddler swish and swallow. Toddlers may not be able to swish and spit. Nothing but water at night after brushing. Fluoride, no supplements before 6 months old, and only necessary if fluoride is not adequate in the water. Dietary factors, foods and drinks with complex carbs are highly carcinogenic. Good Lord, cariogenic. Raisins, sugar, molasses, corn syrup, breads, potatoes, and pasta. Early childhood caries or bottle mouth from allowing to go to bed with the bottle, or use of a bottle of milk or sugary drink as a pacifier during the day. Eliminate that bedtime bottle or substitute with water. Safety promotion and injury prevention. Hey, they're prone to accidents. They really are. Toddlers, they're curious. They like to explore. They have a lack of understanding of cause and effect to gauge the danger, and they have really poor depth perception. Non-accidental trauma, such as physical child abuse. Toddlers at higher risk due to their mobility and emotional development, such as the negativism and temper tantrums. If you have a mom that matches that, can you imagine what it would be like? So moms and dads need to practice safe scolding. I don't know of any other way to say that. Safe scolding. You don't want to you don't want to take a belt to your 2-year-old. Motor vehicle safety. MVA is the number one accidental death after age 1, and ages 1 to 4 because of lack of or improper use of car safety restraints. Always read and follow the owner's manual. Up to 2 years old, they should be rear facing and middle of the back seat. See, I know that's a recommendation. That's kind of hard to do when you have a mid-sized vehicle and you have 2 children to put somebody in the middle. Somebody's going to go on either side. Harnesses should fit securely. No add-ons such as blankets between the child and restraints. You have to be also aware of the 3-year-old. The 3-year-old will, as I caught mine doing yesterday, take that the chest piece and push it down because he says it's too tight. I don't care if it's too tight or not. That's what's going to keep you in the seat, bud. Push it back up. After 2 years, Children can be restrained in a forward-facing car seat. Again, middle or rear seat still best. Motor vehicle related injuries or death, getting run over, or vehicular hyperthermia. I've already talked about that one. Um, you need to make sure that you're aware of where the toddler is when you're leaving the house. Make sure they're not haven't followed you out, and mom doesn't know about it or dad doesn't know about it, and you accidentally run them over. I know someone that's happened to. Drowning, developed locomotion skills allows them to access bathtubs, swimming pools, hot tubs, etc. They don't understand it's a danger and that drowning is an absolute threat for them. Death can occur in minutes for them. Close adult supervision when they are near any water source, inside or outside. You should get them swimming lessons. Water safety classes and fences around the pool are good, but not necessarily sufficient. Safety promotion and injury prevention. Burns. Second cause of death in girls 1 to 4. Third cause of death in boys 1 to 4. They are able to stretch, climb, and reach. We have to educate moms and dads. Pot handles should be turned to the back of the stove. Guards in front of heaters, fireplaces, radiators, etc. Other sources of burns should be kept away and out of reach, like hot drinks, candles, cigarettes, irons for clothes and hair, and hot tap water. I have one there for you. When my almost 2-year-old has probably been about 6 months or more ago now. Mom decided that she was going to straighten her hair in the living room, and she has a Chi straightening iron. You ladies know what I'm talking about. And she was, the littlest one was asleep, and Oliver was in the living room with her, and she put it down, and no sooner did she put that down, and he reached and grabbed for it, and he got some severe burns on his hand. So moms and dads have to be aware of that. Babies are going to reach up and grab it. For him, he didn't have to. She was doing it in the living room, thinking that was a safe thing to do, was to straighten her hair there so she could watch him. Hot tap water is another burning hazard. Electrical burns. Outlets should be covered. Place furniture in front if possible. What about cords? Cords do not need to be hanging down. Those babies will grab a hold of those cords and bite them, or they might pull the lamp down on them. Accidental poisoning due to medications, plants, household products. Toddlers are at highest risk related to the curiosity and ability to open child-proof containers. Proper storage is very important. They put it at a high level, locked cabinets. I have another story there. My son, he was probably about 2.5 or 3 years old, and I had been sick, and we lived in an old house at that time, so that the doors didn't shut really good, and the bedroom doors. So if you shut the bedroom door, there was a latch on the outside where you could lock it down. And my husband had come in the room and went out knowing that I had medications out in there. And I had told him, if you come in and leave the room, make sure you lock it so Samuel can't go in there. Well, he didn't do it. And Samuel went in there, and he got into my child-proof container of Finnegan. We still don't know how many of them he actually ate, but yes, we ended up in the ER and activated charcoal, and it was a big argument, just so you know. So, tell moms and dads, you have to put it up high. You have to put it out of reach. It's not, they can get into it. You can't just trust that, they can't open that bottle. Falls, stairs, playgrounds, windows, cribs, bunk beds. Children under 6 should not sleep on the top. High chairs, grocery carts, and chairs. They need constant supervision due to ability to climb and lack of understanding of danger. How many of you have ever been at Walmart and seen a mom walking around and they reach over to grab something off the shelf and they take their eyes off their toddler who proceeds to stand up? It's all I can do is to not go up there and go, oh, no, 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 because I've seen children that have fallen out of carts in Walmart and hit their head on the pavement. Aspiration and suffocation. Everything goes in their mouth. They can aspirate on toys, foods, balloons, buttons, earrings. These can cause significant harm by either blocking the trachea or piercing the airway. I think I even told y'all about a story of a button battery that a child swallowed that he has lifetime problems now. They can climb in and get trapped into old refrigerators, ice chests, ovens, toy boxes. You need to have carbon monoxide detectors and smoke detectors in all areas of the home. They're also at risk for bodily injury due to their clumsy gait. You have frequent falls. So we need to be aware of sharp objects. They should not be allowed to walk with any sharp objects. Pencils, forks, scissors, etc. Firearms should be unloaded, have a trigger lock, and placed where a child cannot get it, like put it in a gun safe. This goes for toys such as paintball guns, pellet or BB guns. Glass doors and tables, they need to be taught not to run or play around glass. And stranger danger. Oh, so important. And you hear so many children being abducted in this world. But it is more important than ever that we talk to them about if it's somebody that the child doesn't know that could abduct them or harm them physically. But it can also happen with the people that we do know. I mean, it does. It's sad to say, uncles or very close friends, and we read stories all the time and we think, how in the world and why in the world? That is the end of the Toddler in the Family. I will see you in the classroom.